Hey everybody, Kevin here from ChangeWorks Interactive. Today I have a very special guest who I've gotten to know over the last couple of years. And I've gotten to know Mitch well because on many different occasions, Mitch has sort of put me back together, whether it's my neck or my back. Mitch happens to be the head physiotherapist at Shedden Physiotherapy, with locations on Cornwall in Oakville, as well as a Burlington office as well. Mitch, welcome to the show.
Thank you for having me.
Great. Let's kind of get right into it right away. And you know, I know that teaching is important to you. I know that, you know, when you're using the techniques that you use, that it's always evidence-based modalities that you like to use for your patients that are either experiencing, you know, maybe it's chronic pain, or maybe there's customized rehab programs that sort of get them back to where they want to get to. And you're always sort of tied into the education part of it or the personal growth side of it. And I'm going to be lucky enough next year, for example, to do a little co-presenting with you at a dental conference, which I'm looking forward to. Yeah. Yeah, I'll jump right into a question right away, Mitch, and it's not a hypothetical question. It's a question that I've experienced myself. So I've injured myself, as I mentioned. I like to play golf. I used to be more active playing hockey and some other sports, but I've injured myself, and I know that sometimes rest is good for me, and there's other times then when movement would be better for me. How do you as a physiotherapist differentiate between, well, this patient's going to need some rest, or this patient would benefit from some movement activities?
I would say the sort of trend over the last 2 decades has definitely been moving away from this so-called shutdown rest. Okay. We see through the evidence, we see through practice that the sooner we can get people moving, the better and quicker their recovery. So when a patient comes in, we as therapists have to assess where are they in sort of the spectrum of their injury. Are they coming to us in the very acute stage, you know, first 72 hours, the subacute stage, day 3 to day 21, or the sort of chronic stage, which is after 3 weeks. So from there, you look at the patient, you say, okay, would this patient benefit from me providing them with that routine to move right away, or do I feel that's going to hinder some of their recovery? Mm-hmm. So a lot of factors, obviously, that go into, but I would say the general rule of thumb is we are trying to get people moving sooner, and we see the results of them returning back to their activities quicker.
Okay. When do I want to get into sort of this, maybe it's sort of along the same lines, but when would I sort of get into more, you know, range of motion exercise if I'm injured versus this controlled sort of loading phase?
Yeah. So I would say it all depends on your pain tolerance. So a patient comes in, the first thing that we're looking at and we're assessing on day 1 is, what is your range, what is your strength, and what are the sort of demands of exactly what you need to do, whether it's sport, whether it's work, whether it's life. Where can we start to get you as soon to those functional activities as we can? So typically, range is going to be the easiest thing to get patients to do. Yeah. Right? It gets them to start moving, you know, a bunch of benefits in just doing that, circulation, joint lubrication, etc. And also desensitizing the system versus, you know, even starting with some light loading. But the goal is always trying to get the patient strong through their range. But I would say, rule of thumb, you start with range. It's the easiest. It's going to provide less stimulus in terms of over-exacerbating their symptoms. And then as they get, you know, as they can tolerate that, you start to load and figure out ways that they can manage that.
Yeah. Just as a little bit of an offshoot, one of the things that I appreciated and I do appreciate as a patient when I walk into Shedden, and I could really sense what the culture's like there, and that's everybody, Mitch, from your front office staff to what you see on the walls. That creates a culture as well. But when you walk into the main part of the room, you'll see some therapists talking to each other. You'll see other staff that are perhaps working with patients, but everybody is talking. Everybody is sharing, and that's what I really like about the space. It makes you feel like the environment is conducive to healing. Would you be able to talk about that at all? Like how's that? And that's like that secret sauce. How do you create a culture in which people feel comfortable and they want to come back?
That's right. We got to give credit to Dana Clark, who is the owner and operator of Shedden, and he had that vision. So, there have been several different clinics that I've worked at, and you either find the clinic where it's very private. You walk in and it's all rooms, closed door.
I've been to some of those.
Which
sheltered.
is fine. And you know what? I'll be honest. We offer that component at Shedden because there are patients that just want more privatized care, and there are many different people, shapes and sizes. We have to accommodate all.
Yeah.
But I find this environment that we're in at Shedden, it's more of a sports-oriented environment where there feels more of that team collaboration. So as you said, you walk into the clinic, the admin is setting you on the right path, right? Who are you seeing, where your appointment is, and then send you to the back. You see the frames on the wall, the pictures, the athletes, and right away you get a sense of trust. Okay, there have been a lot of people who have been through this clinic and obviously showing some degree of success. And then when you get to the open area, you see, wow, there's a lot of therapists, there's assistants, there's massage, sports medicine physician, chiropodist, chiropractor, a full team that is willing to work together to get you where you need to be. And I find that sort of open concept with the clinic, it's amazing what it does. It heals on its own, because you could be overhearing a patient 3 beds over on their journey and realize to yourself, wow, I don't have it that bad. Or, you know what, they're going through similar things that I'm going through, and I hear the optimism that they have. So, I feel like I could learn something from this as well.
Yeah.
So, it's something that I think we take for granted, that we don't realize how much it helps clients, but you hear it all the time when people come back and appreciate sort of that environment.
Yeah, and I think there's a good dose of humor that's thrown in there too, because I think some people, you could speak to that, I'm sure, but I think some people have some pretty serious pain or some serious chronic issues that they're going through, and humor probably helps a lot.
Absolutely. I have patients that I've been seeing for 10 plus years, right? And they need to come in on a weekly basis to keep them at their current level of function. And as a therapist, I'm now out 13 years, and I would say COVID was sort of the biggest time frame that sort of allowed me to reevaluate what I was doing with patients, whether it was good enough. Because you tend to get into these consistent patterns with chronic patients. You're seeing them weekly. You try a couple of new things here and there, but you sort of work to finding your secret sauce with them.
Yeah.
What they feel that works for them and what you feel that works for them. But sometimes as a therapist, you're always reevaluating. It's like, is what I'm doing actually helping them? Because in a chronic patients, you're not necessarily going to see positive change.
Yeah.
They sort of plateau, but you're assuring that they're not declining in their care.
Yeah.
But when COVID hit and we got shut down for 2 months, one of my patients, longstanding patients, said, I feel like I've gone back 6 months. So I hadn't seen him for 8 weeks, and he felt a 6-month decline.
Wow.
So that to me opened my eyes, saying, wow, okay, so clearly what we're doing.
Yeah, and that almost sounds like that's in a lot of different areas, perhaps of that patient's life, that get impacted, not just the physical.
Yeah, of course.
Yeah.
And so, not being able to come to the clinic and, having that camaraderie and, like you said, we provide a lot of humor when working there, and just get, knowing the team, and everyone knows him, asks about him, how he's doing, etc. Right? So,
Sure.
That was a tough time for everyone, but it really opened my eyes to how the therapy was impacting.
So as a practitioner, as a therapist, do you have Do you have somebody that you would consider an ideal client? Because I imagine you have athletes, you have also people that have suffered motor vehicle accidents, for example.
Honestly, my ideal client is someone who wants to get better, right? So it doesn't matter if you've been dealing with the issue for 25 years or 5 days. If you're motivated, I will work hard and willing to work with you to get you where you want to be.
Yeah.
You have other instances where it's not going to be that simple. There's a lot of, social factors, mental factors that play into a patient's capacity to being able to reach those sort of goals that they have. So,
Right.
Those are roadblocks that sometimes we have to, face, and sometimes we need to pull in other healthcare practitioners to get us over those hurdles.
Well, let me piggyback on that a little bit. Like, do you ever run into situations where, like you're somebody that has chronic pain might be experiencing anxiety or depression? Are there ever discussions within the clinic about, okay, perhaps we should reach out to somebody else, whether it's like myself or somebody else that provides care? Do those allied health professionals ever help the physiotherapist or people that are working directly with those patients from your clinic?
I mean, I believe that's why we're very well-rounded in sort of the scope of dealing with pain, because we try to be able to determine sort of where the true source is. It is the most challenging thing to be able to determine because there are so many factors. But, pain can manifest in so many different ways. Mm-hmm. And there have been patients that their pain might be 90% psychological and mental health related, but it's showing itself in a physical entity.
Yeah.
But when you're an experienced and seasoned therapist, you start to determine, these, I'm going to say factors, but also these patients, they present this way. And then that, as a therapist, is where you have to educate the patient and say, I feel like your depression, your anxiety needs to be better controlled in order for us to be able to move towards where we'd like to be. Yeah. And so that's where it's either the introduction of, I recommend you go back to your family doctor, get a proper referral to a psychotherapist or a psychiatrist. Yeah. Where as physios, it's still within our scope of practice being able to communicate what we believe is correct and what we feel is the right path. However, in these instances, we'll typically rely on allied health professionals to sort of pick up from where we left off to be able to, again, get them over.
Well, it's interesting that you said, I like working with people who are interested in getting better, right? Sometimes, my experience too, that anxiety or depression sort of stops them in their tracks, where they feel like they can't get better, physically, mentally, emotionally, everything, right?
I usually say they're stuck in the mud.
Stuck in the mud. That's a great way of looking at it. But maybe there's some hope there that you don't have to be stuck in the mud. There's always a plan B. There's always things that you can do.
That's right. Yeah, I would say when I first started off as a new graduate, it was very overwhelming. I felt like this person in front of me, I have to be their sole practitioner and I have to care for them. Yeah. But in certain instances, very quickly, you realize I don't have the capacity by myself to fully care for this individual. Yeah. And as you become more experienced, and the benefit at Shedden is we have so many different practitioners with depths of experience, we can piggyback on each other's experiences to, say, hey, I have this patient, this is what's going on, what do you think? And so with that, we've developed this social network of, all allied health, and we have a pretty good referral source that I feel confident now in my practice that I could speak to anyone with any sort of issue and condition and at least have a good idea of where I'm going to direct them.
Very good. Very good. Let me throw one at you, Mitch. Bit of a little, case study sort of scenario. A lot of young people that I'll see in my practice that are athletes, and quite often they're about to enter some kind of concussion protocol, or they've had a series of concussions, and it seems like this is getting worse, so that it affects their obviously their ability to participate, but it's also affecting other areas of their life. They're not able to go to school, or they need to take time out, or they're experiencing all these physical symptoms, right? Where do you start with someone, a young athlete, for example, who presents with perhaps a series of concussions, and they need to get, maybe they need to get an assessment, maybe they need to get on some kind of regimen that's going to help them feel better so that they can get back on the court or get back on the ice or whatever they like to do?
Yeah, so multi-layer.
Yeah,
that's a multi-layer patient, right?
Yeah.
So, let's just say that patient's coming in day one.
Well, I'm sorry to bring you back to your days in McMaster, where you'd probably get a question like that on one of your exams.
I mean, this is what we deal with on a daily basis, right? So, patient comes in, and I'll be honest, that first session is just education. It's empowering the patient. It's being able to lay out that roadmap for them so that they can see, okay, these are the things I need to work on, and this is the road that we're going to take. Mm-hmm. However, I also provide them with, if we're going this direction and you decide to veer left, this is the direction we're going to go. So providing them sort of like a map algorithm of, we're going to work on A, but it may lead us towards this, to C, but we're hoping we stay on trajectory B, I feel is the most important thing to do with those patients day one. So in this case, we talk about the importance of physical activity, providing circulation to the body, regulating hormones, regulating muscle use, the nervous system use, and regulating ATP. That's so important for exercise. You talk about sleep hygiene. You talk about diet. You talk about, the mental health of things. So an individual, athletes, what do they love? They love competing, but if they're in a team sport, they love being around the team. Yeah. So we encourage social interaction as much as they can tolerate. Yeah. So we often talk to athletes, especially who are concussed, and we'd say, listen, you are able to do a lot of things, but you have to remain within your threshold. So you have a threshold for everything. What that means is you might be able to tolerate 15 minutes of TV time before you start to get symptoms. That's your threshold. You might tolerate 10 minutes of Zoom calls with your buddies. That's your threshold. You might tolerate a half an hour of talking one-on-one with one of your buddies. That's your threshold. So what sort of we advise patients to do is work up to your threshold every day, and every few days try to add a little bit more.
Isn't the idea of this progressive overload?
It is. It's exactly what it is. Yeah. So, and we obviously tell patients, journal it, right? Because I want to see, where are you struggling? I see that you've increased your TV time to half an hour, so I'm thinking more visual ocular stuff is maybe not impacting them. But I notice that when they are in more, louder environments, they don't tolerate as much time. So I'm thinking auditory overstimulation. Yeah. So it's a lot of those things that gives us a lot of feedback in terms of being able to push them forward, but it's exactly that. I would say a decade ago, not that long ago, we were telling patients, rest, shut down, dark room, rest completely, let's see you in a week. But then we were finding that they just became hypersensitive to everything. Their brain was essentially adapting to their environment. Mm-hmm. If your environment is zero stimulus, then you don't want to be stimulated. Yeah. So we find this symptom threshold level to be the best guidance that we give patients, along with the regime of, here's information on your diet, your sleep, follow these plans. This is the most evidence-based information that we have. Do it as best as you can. Sometimes, refined sugars you're cutting out of the diet. Sleep is very difficult for kids sometimes to achieve. Yeah. But at the end of the day, you're just saying, listen, this is what works. You try and stick to it as best as you can, and we're going to see where we can get.
I love it, Mitch. You bring in all that stuff, all that science background to what you do. I love that too, because I started out science field, and then I with the psychology, I try to bring that together as much as possible. So the two definitely complement each other. I want to thank you so much for joining us today and talking to us about your patients and talking to us about Shed. What's the best way, if somebody's watching our program, what's the best way that somebody could get in touch with you?
I believe our website, www.shedandphysio.com. Every single therapist is on that website, and I believe there's a button to reach us directly, whether it's via email or you could call the clinic. But I always tell people email is typically best. I respond within 24 hours.
Okay.
If I had any issues.
Okay, that's fantastic.
I always tell people as well, like, if you're unsure, just pick our brains. Like, we're here to help. I know a lot of people sometimes, physio hasn't worked for me in the past, or I've tried so many different health professionals modalities. I'm sure that this doesn't work, or I'm not sure. And I tell people, listen, it's not always about the profession, it's about the professional.
Yeah.
Right? In any profession.
Yeah.
Right? So
good advice.
Talk to someone if you feel like there's something that they could provide you that maybe you haven't done, or they provide a different scope or shed a bit of a different light in terms of the path that they want to take with you. That's sort of what people are looking for. So I say, get on the phone, shoot an email. It's the easiest way to contact people, and we don't veer away from that.
Wonderful. Thanks so much, Mitch.
No problem. My
Okay.
pleasure.
Talk to you soon.
Take care.